So excited.
Yeah, I'm excited too. Okay, so we're going to cover like 4 different parts today in your consultation. So we're going to cover what you're looking for in your expectations, what the treatment is and what you can expect, pre-care and aftercare, and then any patch test and health information as well. So I think first things first, like I just want to know like what you're looking for.
Well, just basically, like if I look in the mirror, just my colour just goes a bit dead. This is it on a good day, but it goes quite grey.
Okay.
So I just like to, I always find myself having like lip glosses and lip balms. I always do like a coloured one.
Okay.
So I just like to have
you've got like,
just
so
like
your
some
tone
more
is quite
natural colour.
Yeah, okay, fine. So your tone is quite cool.
Right.
If you say like you feel a bit washed out on some days.
Oh yeah, I feel like I go grey.
Okay, cool, yeah, perfect. So what we can do is choose like a slightly warmer colour that like might warm the tone up a little bit. It just makes you feel a little bit more alive on those days when you feel a bit tired and flat.
Yeah, it's all the time.
So in terms of shape, I mean you've got an amazing lip shape anyway, and
I'm not bothered about like trying to make anything appear bigger or anything. Just want to get some colour on it.
Yeah, and we won't do that anyway. So we tattoo within the parameters of your lip, and we try and keep it as natural as possible. Yeah. So what we do though is tattoo right up to the edge of the vermilion border, and that's where you tend to lose a bit of colour. So on those flat days, that's where the colour will sort of go from the first. So what it does, it can make your lips look a little bit fuller, but it's like marginal. Fine. What's your understanding of lip blush?
So I've heard that it's like a semi-permanent tattoo.
Yeah.
And all the photos I've seen look amazing.
Yeah.
And it gives you just like a lovely blush of colour.
Yeah.
So it's just like a real nice natural enhancement.
Yeah.
And I heard that it lasts 2 to 5 years,
Yeah.
which is amazing. So that's all that I know. Yeah,
so I mean that's it in a nutshell. It is really similar to a tattoo. I suppose the biggest difference is the placement of the ink. So we do it at like a more shallow level than normal tattoo.
So it doesn't go deep.
Yeah, it doesn't go deep in. Down to the skin, and the reason we do that is that it enables the pigment to break down over time. So that makes it semi-permanent. Also the pigments don't have as much pigment in them as sort of normal tattoo ink, so that means that it enables the body to break it down over time. And then the other thing is the machine that we use, so it's really similar to a tattoo machine. It's just less powerful. So where the tattoo machine is normally designed to like punch right into the skin, we want it at a less level, so it's a more gentle machine basically.
Can I ask a question?
Yeah, of course.
When it like gradually fades over years, how does it fade? Is it going to be like just slowly gets lighter, or will there be colour bits in some places and colour bits in others?
No. So it's a natural fade. It takes a while to fade out, so I'd say like 1 to 2 years you'll still see the colour there, and then as the years pass you won't see the colour unless you stretch the lip, and then it just ends up sort of disappearing altogether. So I tend to use warmer colours, or a cooler colour. If I do use a cooler colour mixed with a warm, because what we don't want is them to fade cool as the years go by. My preference I'll always steer people towards a slightly warmer colour, just because I care about the long-term results.
You don't want them to look even more
cooler.
Exactly.
So that's just a thing that you need to be really careful about. And the other thing about my tattooing style, which might differ from other artists that you can see online, is that you often see the lipstick effect online, and what that means is they're really saturated lips. Now you're shaking your head like you don't.
It's too much.
But some people really love that, and unfortunately that's when you see it doesn't fade nicely. So the way that I tattoo is super light and scattered, so it's very pixelated and it's not heavy saturation. They always look quite bright when you first had them done, but then after a few days it will fade to a more natural colour. They always look about 50% darker when you first have them done, and then exactly the same. Absolutely. Like I said before, the pigment is designed to fade over the years, so we expect it to last like 3 or 4 years, but it can last anywhere between 2 and 5. So it's a good procedure for longevity. And if you want a colour boost, then you can. We'll review it at a year to 18 months.
Okay.
I won't give you a colour boost if I don't think you need it.
Yeah, okay.
So quite often people can come back and say it's faded, and it's not that it's faded, it's just that you're used to seeing your lips like that now.
Yeah.
So
that makes sense.
Yeah, so and what I'll do is have a look at the lip, I'll stretch the skin, and if I can still see good saturation, I'm not just going to take your money and top up. I'd rather not, because you don't want to end up with oversaturated lips that end up fading cooler over time.
Okay.
On the day, we ask you to allocate 3 hours for the appointment, and that's made up of lots of different things. It's not 3 hours of tattooing. So we've got the health declarations, we do all of the pre-drawing of the shape, and then that gives us time for the numbing cream. The lips do swell when you tattoo them. So what we do, we have cold compresses. So I've got like ice blocks that you'll put on your lips between passes, just to take the swelling down a little bit. So just expect that when you leave, your lips will be swollen. It looks a bit like you've had filler, but it does go down normally within like 2 to 3 hours, and it'll be totally gone by the next day. To speed the process up, you can go home and just put some ice on it as well.
It makes sense.
Yeah, good. Okay, so the next bit I just wanted to talk to you about was lip shape, because that's the bit that people are often sort of quite interested in hearing about. So what we do firstly is measure out your vermilion border. Like I said to you before, that's like the very edge of the lip. That's usually like where we lose most of the colour. So it's really important that you get that like bang on, so that you've got the colour right up to the edge of your lip.
Amazing.
Then what we'll do is take photographs to check symmetry. So it's quite hard to see symmetry sometimes just by eye. So we'll sit down, we'll take photos, and we'll look at the photos together, and then hopefully between the two of us we'll be able to agree that they're perfectly symmetrical. If your lips are unsymmetrical, we can only tattoo as much as we can to what your lips are already there.
You can only go over what you naturally have.
Yeah, absolutely. So we can tweak it slightly within a millimetre. But that's it, we can't go any further than that. So if you do have asymmetrical lips, then we'll just do as much as we can, but it needs to be within the parameters of what you've already got. It would also look a bit weird if you're used to normally doing your lipstick in a certain way, and then we tattoo something different. It just doesn't work. So like I said to you like before, we just want to keep it within the parameters of the lip as much as possible. So that's it on shaping really. The only other thing I'd say is I do it in red. So when we try colours on in a bit, we can do it in whichever colour you'd like, but when I draw the shape, I want to be able to see a really crisp outline. So I need that to be bright. So when you look in the mirror, don't freak out. It will just be red, and I won't be tattooing your lips that colour unless you want that colour, obviously. Okay, let's talk about colour then.
Amazing, so many there.
So I've got a colour chart here, so I've got most of these colours. We can mix colours as well. But what I want you to look at is the bottom. So look at the tone and think about if you
they're all gorgeous.
Yeah, they are really nice. But so think about like the tone, I suppose, and what you would normally wear. So if you were like to be drawn towards one colour at the bottom end, what do you think you'd sort of go towards?
So all my lip glosses are kind of in between these two.
Yeah, nice.
Probably more this one is what I've got, like 5 different lip glosses. They're all that colour. But I do also like all my favourite lipsticks are kind of that orangey red. And I kind of envisioned in my head maybe doing an orangey red, but this is what I always buy. If that makes sense.
Cool. Yeah, no, definitely. So we can try them. So Flame, it sounds like would be perfect for your. That sounds perfect for your like what you'd normally have in lipstick. And then the Perfect Pink sounds like what you'd have day to day. So it's really important that what you think about is what you're going to be happy seeing on your lips every day. So sometimes with the brighter lip colours,
I think maybe go for the more chilled pink then.
Okay.
Because that is my everyday colour. I don't want to maybe do something that was too bold in the moment, and then I might think, oh, this is too much.
So the only thing I will say is, like with all of these colours, they will be quite subtle. So even with the Flame, I've got an example actually of a girl that I did with Flame the other day. You've seen it,
I thought it looked fantastic. I know, part of me is like, don't play it safe, because then you won't
she
look
said the same
different.
actually, and she had pink before.
Really?
She had an old lip tattoo which was pink, and then she got me to do the Flame over the top. But we can try them both on and just see which tone.
Let's try them both on. Brilliant.
So the good thing about it is I've got lip pigments that match all of the pigments, so you can actually really try it on and get a feel for
properly.
It. Yeah, absolutely.
Amazing.
I'm just going to grab a tissue.
Hear great things about Tina Davies as well.
Yeah, it's really good. Such a nice brand.
Yeah.
The thing I like about this brand as well is it fades nicely.
Good.
So they don't tend to go cool over time, which is perfect. And they've got a really good reputation generally. Let's start with the pink then and see how you feel about that.
Oh, I'm excited.
So this is quite bright. Obviously, you've just got to bear in mind that
it won't be
as bright as this.
Yeah.
So what we're getting you to look at more than anything is the tone.
Okay.
Do you want to do it actually?
Shall I do
yeah.
It'll be easier.
Oh, that's nice. Oh, that's nice.
It's such a difference straight away. I mean, will it be like that or will it be dark? Will it be lighter?
No, it'd be lighter.
Faded?
Blot it though. That's why I've go with the tissue because that is quite bright.
I never blot my lipstick or things. Is that something you're meant to do?
There you go. That'll give you more like.
Wow.
Yeah, it's nice, isn't it?
It's nice. It's more. It is a bit more. To be honest, a bit more
pink than you'd normally go.
Than what I would normally go for. But it is hot though.
Yeah, it's really nice.
Amazing. Okay, shall I try the red?
Yeah, try the red.
This is though kind of what I do wear.
We can mix it though. You don't have to. If you wanted to tone it down a little bit, I'd say that the next one down from that is the pink coral is really nice.
Yeah, if you don't mind, I think I'll try on a couple.
Yeah, of course. Try the flame. So this looks really different when it goes on, and then when you blot it, it looks quite different again.
This is incredible.
It's lovely, isn't it?
I think, yeah. Oh, I think this is
yeah.
hard to this is dreamy. I don't even think this is that bright, and I haven't even blotted it yet. And can I just say one thing I'm so excited about? So, whenever I go out on nights out or this or that, and I have my lipstick on, my friends have to be on lipstick watch because I get it on my teeth. I do it on the night. My red lipstick goes everywhere. So this, I'm just not going to need to worry about at all. So how's that?
Lovely.
Ooh. Oh yeah, that's gorgeous. I feel like with my colouring, that looks so nice.
Yeah, it does. Really suits you.
And it's interesting as well. They always say you go with your first instinct.
Yeah.
And this was from that photo that I saw of yours that I love.
Yeah.
Yeah, that's really pretty.
Yeah, it's really nice.
Okay, can we just try that one other?
Yeah, of course.
And we've got a full... This is so much fun trying on all these different lip things. This is so cool. Oh my god, I'm just dying over that red.
Wow, that's gorgeous, isn't it?
Oh, dreamy. Oh, this is also lovely. Oh yeah, that is quite... It's beautiful.
Yeah.
But that is quite pink still. But all these colours are stunning.
Yeah.
Can't wait to tell everyone about how incredible these colours are. These colours are incredible, guys! Oh, that's also beautiful.
Yeah, they're really nice, aren't
really
they?
Gorgeous.
They're all really natural as well.
They're all stunning. I'm going to go for... Oh, it's really
That is, I know, it is really nice. Yeah, I know.
Maybe I should go for this one.
I do like that one. It's the most, I'd say it's the
most
closest.
Everyday, isn't it?
It's the most everyday. They both are really nice though. What we can do is try again in your appointment though. So like, we don't have to decide right now. You can just have a think about what you like best. We can take a photo of some of the colours and stuff.
Yeah,
and then...
I think I'm 70-30 the red though.
Yeah.
That was...
Well, I'll show you again.
They're all so beautiful.
Yeah, they are really
So all
nice.
of them would look good.
Yeah, definitely. you definitely suit the warmer colours as well, like that. The red straight away, I was like, and because you've got the green on as well, they go really nicely.
Yeah, amazing.
Cool. Okay, so that's it for colours. So quite often people ask me just about the pain level.
Okay.
And I would liken it to, it feels scratchy.
Yeah.
That's the best way to describe it. So we do use a strong numbing cream.
Okay.
At the very beginning, and then also like midway through, if you're feeling pain, we can put another sort of anaesthetic on.
Okay.
What we don't want to do is overly use it, because it can dry the lips out a little bit, and you need like nice, like nourished, soft, supple lips to tattoo them and get the pigment in there properly. Okay. If you're on your period, it can be a little bit more painful.
Yeah.
The only thing I would say is just make sure that you don't take any sort of ibuprofen or
paracetamol.
No, you can take paracetamol,
Okay.
just nothing that thins the blood, basically.
Okay.
So nothing with aspirin in it. So ibuprofen is a no-go.
Got you.
I did some girl's lips the other day, and while I was doing the outline, she fell asleep.
Oh,
so
wow.
and I was like, and she did a little snore.
Yeah.
And we were laughing about it. So
that's good.
Yeah. So that was the kind of, she was like, I can't feel it a lot at all. But then as the time goes on, and because you have to do 2 or 3 passes, so 2 or 3 times over the lip to get the pigment in.
Yeah.
It's as it gets towards the end, it gets a little bit scratchy, but it's not unbearable.
Yeah.
I'd always rather say, like, let you know the level of pain to expect.
1,000,000%.
Just so that you don't come in and
And it is a real procedure, isn't it? So you need to think about these things.
Yeah, definitely. Yeah. So there are some really important pre-care sort of instructions I'm just going to go through with you now, just so you know in advance of your appointment. You kind of just need to come prepared, basically. So the most important thing is that your lips are hydrated before you come. So 1 to 2 weeks before, every few days, I need you to scrub your lips. Now, you can use either like a lip scrub, or you can do a homemade sugar scrub, or you can use a dry toothbrush. But you need to just make sure that you're getting the skin right off those lips and making them nice and soft. And then the other thing I need you to do is regularly moisturise your lips. Now, a lot of people think that Vaseline is moisturising. It absolutely isn't.
Yeah, I've heard that as well. It's like the worst thing for it.
It's a barrier cream, so basically what it does is stops any moisture getting in. So it does the opposite, essentially, of what you need it to. So I need you to find a lip balm that is moisturising.
I like the beeswax ones.
Better, much better. So you want to look at the ingredients, avoid anything that it says petrolatum as its first ingredient, because that's what Vaseline's made out of. Moisture. So when your lips, if you come in and your lips are really dry, the needle just won't go in.
So when you say moisture, like 5 times a day?
Yeah, just like
10 times a day?
No, just like what feels comfortable. But you just want to, like, before you go to bed, like it's that, like, before you go to bed, like, make sure that, like, so I've got like a really oily moisturiser at home. That before I go to bed, I'll put that on my lips, and then I put lip balm over the top. And it's just that kind of overnight treatment. You want them to feel super soft and smooth.
And is this for the 2 weeks up to the appointment?
Yeah, up until the appointment. So I'd say like every 2 or 3 days, just scrub them, and then the moisturising, that needs to happen like daily, basically. Yeah. Okay, good. So get hydrated. Like, the more hydrated you are, the easier your lips are to tattoo.
So drink loads
of water. And like when your lips are chapped, it tends to be because you're not getting enough water anyway. So loads of water. Don't drink caffeine on the day, and if you can, try not to the day before as well. No alcohol, no drinking caffeine.
It dehydrates you, right?
Yeah, absolutely. And the other thing is, it can encourage bleeding. Now, your lips don't bleed generally, as a rule of thumb. However, you want to make sure that you're in a good position to take as much pigment in as you can. So yeah, just avoiding anything like that is really good. Also, I mean, the weather's not there at the moment, but we ask no tan or suntan or anything like that. And then, like I said before, so no ibuprofen or aspirin, just because it thins the blood. And then I always say to people, just make sure you're well rested the night before. I know it's a small thing, but it is important, because I don't want you feeling like stressed or anxious. You know, we want you to feel relaxed and calm before your appointment.
Makes sense.
So in terms of aftercare and healing, the main thing to let, and we've spoken about it a bit before, but the main thing to let you know is your lips are going to swell. it's completely normal and it will go down within 24 hours. I'd say that it takes 4 to 5 days to heal completely after the treatment. And the lips will look darker in like straight after the appointment. Then they'll go even darker when you go home, and then they'll lighten up as you get some flaking on the lips. So it is completely normal. The lips are going to go a bit flaky. It's not scabbing, but it is a light sort of like you're going to essentially like shed the first layer of your lip. So it's really important that you follow the aftercare in the first like 4 to 5 days, because this is like the key point for like how well it's going to last. Exactly. So on the first day you need to wash your lips every sort of hour to 2 hours. So you need to give them a good stretch, and you need to like wipe them and then pat them dry. And then you just need to leave them so hourly. Anytime after food you need to give them a good wash, and then you need to avoid any hot drinks, any spicy food, anything that's going to make you be licking your lips essentially. Once you've passed the first day, I'm going to give you some ointment that you can apply, and you can apply that 2 to 3 times a day tops. So you don't want you overdoing it. Now what that's going to encourage is your lips to start shedding that first layer of skin, and you'll normally find that they start peeling at first in the very corner of the lips. Now the temptation is going to be there to pick them and help it along. Just don't do that. And I will know if you've done that. So just make sure that you don't, because all that happens is you pull it, your lips will probably bleed. And you're going to pull the pigment out, exactly. And then really similar to microblading and other treatments like that, we just don't want you to soak them. So you can like wash your face, all of that sort of normal stuff, but we just say avoid like hardcore exercise, avoid like long, if you're wearing masks, avoid like a long time of wearing a mask, just because you don't want them to get like super sweaty or anything like that, and you just need them to kind of heal essentially. So yeah, they are going to feel a bit tight and crusty. And that's just normal.
Straight up.
Yeah, so they don't look very glamorous in the first couple of days, but that's completely normal.
And thank God we're wearing masks now.
Yeah, exactly.
Now's the perfect time to get it done.
Yeah, definitely. So, but like I say, by day 4 to 5, it should have completely flaked off. Now they do look lighter. So really similar again to microblading, they look a lot lighter, and you won't see the true colour normally until about 4 weeks. And then you come at 6 weeks for a top up. And then we finish we finalise the look essentially. It is definitely a 2-part treatment. Because you don't know how the lips are going to swell, you don't know how they're going to take the pigment, so they may or may not be a little bit patchy to start with, but it's really subtle anyway, so and any imperfections we can just top up at the next appointment. But yeah, I always just say make that really clear with people. It is absolutely a 2-part process.
It's good to set expectations so everyone knows what the deal is.
Yeah, definitely. After 6 weeks you can book in and complete the treatment, and then you're good to go. A similar thing, like we'll have to go through the same process again, but then after that you'll have like really nice lips. And the best thing about it is you literally just need to put a bit of lip balm on or lip gloss and you are like good to go.
Can't wait.
So we need to do a patch test. And we also need to just go through some health questions as well.
Fantastic.
The most important health question is just whether or not you suffer with cold sores.
No.
You don't? No. Okay. If you did, we just make it sort of really clear that you just need to, there's a special medicine that you can get prescribed by your doctor, and you need to take that a week in advance of having the treatment, otherwise it can encourage a breakout, which is obviously not what you want when your lips are healing. Okay, so I'm just going to go, there's quite a few health questions, and I will get you to fill out a health form on the day, but we're just going to whiz through them quickly just so I know that it's okay for you to have the treatment.
Brilliant.
So just to reiterate that when you come in, no asprin, no codeine, no alcohol, no caffeine, all of that sort of stuff.
All the good stuff.
Yeah, all the good stuff. None of that. Have you had chemotherapy or radiation treatment in the last 12 to 18 months? Good, okay. Have you got any allergies? No, okay. And I'm just going to go through some of the things to make sure that you're not allergic. So adrenaline, anaesthetics, cottons, crayons, hair dyes, glycerin, foods, any foods, drugs, any kind of medicines, latex, no, lidocaine,
No.
Oh, that's a numbing agent, okay. And that's one of the ones that people could be allergic to. So we're going to test you for that anyway today. Nuts?
Nope.
Vaseline?
Nope.
No. Okay, cool. Right, so the next bit is just the health deck part, and that's like just going through all of your sort of health history basically. Okay. So I'm just going to read off again a load of different things and then just let me know. So no heart conditions.
Nope.
Alopecia.
Nope.
Anemia.
Nope.
Blurred vision.
Nope.
Do you bruise easily?
I feel like I bruise easy, but I think it's because I'm clumsy.
Okay.
Like, you touch me and I bruise.
Yeah. Okay. So the reason I ask is the lips can occasionally bruise.
Okay.
And that is completely normal.
Sense. You're putting some pressure on the lips and you bruise easily.
Yeah.
No, I don't think it's that.
Okay, fine. It's just to like make people aware that can happen. It goes down. It's the same as having a lip filler. Like you know, I bruise. Like my whole face goes green when I have a lip filler.
Yeah.
And I just like to set people's expectations that if you do bruise, it's normal.
Yeah.
But
okay. Good to know.
Okay, fine. Chapped lips. Do you get dry lips?
I feel like I get a little bit dry lips, but nothing crazy.
Okay, fine.
And it's because I'm doing bad habits like using Vaseline.
Okay, fine. Yeah, and that's, like we said, you just got to keep your lips hydrated. Epilepsy?
Nope.
No fainting spells or dizziness? No. Okay, good. Haemophilia?
No.
Good. No heart issues?
Nope.
Kidney disease?
Nope.
HIV?
Nope.
Low blood pressure?
Nope.
No.
Is that because you might faint during the treatment?
Yeah. So yeah, we've covered the key things.
Yeah.
And then I just want to double check that you haven't had any of these in the last few months.
Mm-hmm.
No Roaccutane?
No.
Okay, fine. It's for treats acne.
Oh yeah.
No. No AHA preparations, so like glycolic pills or anything like that. No. Okay.
Like that.
No Botox or fillers.
I had Botox in my forehead.
Yeah.
About
not in the last 4 weeks, basically.
No.
Okay, no, that's fine. No laser peels.
Nope.
Collagen injections.
Nope.
No cortisone injections.
No.
No sunbeds.
Nope.
Good.
I wish.
Do you use retinol on your skin?
No.
Okay, fine. Yeah, that's it. So in terms of the health declaration and stuff, I think that you are a perfect candidate.
Awesome.
So all of that's fine, and like I said, I will get you to fill out the form on the day as well.
Can I just ask you a question? If I was using retinol, how would that affect it?
So essentially, retinol encourages the skin to renewal of the skin. So it's more relevant, I think, for eyebrows, but we just like to double check anyway, because some people just do put it all over their face.
Yeah.
So I just say like
it's
avoid.
If you do that.
Yeah, exactly. So
I
just
did get some retinol sheet face masks.
Yeah, just avoid the lip.
To be fair, it doesn't go on the lip anyway.
Yeah.
But it's just good to know that.
No, yeah, absolutely. Okay, cool. So the only other thing I need to do is a little patch test on you.
Fab.
Okay, so we're going to do a patch test now. We're going to patch test for 3 different products. So we're going to patch test firstly for the pigment, and what I'm going to do is a little tiny scratch in the skin, just because I want to see how it actually reacts with the skin rather than just the surface.
Perfect.
And then following that, we'll patch test for the numbing cream and the anaesthetic as well.
Awesome.
So just in terms of patch test and stuff, what you want to make sure is that there's no itching, no redness, no swelling. It's really, really rare that you do get a reaction, but if you do, it's obviously really important to let us know, because the worst thing that could happen is that we could tattoo your face and you'd have an allergic reaction. We absolutely don't want that. Like I say, the products are super safe, but it's just to be good, to be safe than sorry.
Sounds good.
So I'm just gonna do
so do I leave this on for the next 24 hours?
Yeah, leave it on for 24 hours.
Okay.
I mean, normally you'll know within like an hour, half an hour, if you're going to have a reaction to it.
Yeah.
You don't need to break the skin with this one.
Okay. Yeah, because it'll just be on the top.
On the surface, yeah, exactly.
Right.
I need to do this one as well, actually. I've just realised.
Oh, I've had this before.
Oh, I was going to say you must have had that one before.
I've had this one before.
Fine. Cool.
So is that it?
Yeah, that's it.
Awesome.